Okay, so when you think about healthcare giants, I mean, UnitedHealth Group is right up there, isn't it? Just massive.
Oh, absolutely. One of the biggest players, easily.
But looking through these materials, it's clear they're not just, hitting a few bunks. The sources are calling it a seismic transformation.
Yeah, that phrasing really jumped out. It's not
Yeah.
just turbulence. It sounds like the whole industry is watching them. Investors are definitely nervous.
Right. Holding their breath, as one source put it. And it seems United Health isn't just tweaking things. You mentioned something about rebuilding mid-storm.
Exactly. The analysis suggests they're fundamentally changing course while everything's chaotic around them. It's shaping up to be this huge story with impacts way beyond just their stock price.
Which is exactly why we're diving in today. We want to sort of unpack this whole complex situation around United Health in 2025. Using the sources, let's figure out what on earth is going on, why we should care, and maybe what happens next.
Sounds good. Because it's quite a list, isn't it?
Yeah.
Leadership changes, regulatory issues, pulling back from global plans.
And some really strange, unfortunate events, too. It's become like a textbook case in crisis management. Or maybe how not to manage a crisis.
Well, yeah, we've got CEOs leaving, one tragically dying under mysterious circumstances, billions seemingly vanishing overseas. That's a
Okay.
lot. Really shows how even the giants can stumble.
Okay, let's start right there with the leadership chaos. The sources talk about the Whitty exit. Sir Andrew Whitty, he was the CEO.
Right. And he left pretty abruptly back in May 2025.
It wasn't a quiet departure, was it? The materials say he basically jumped ship.
Yeah, right as the stock tanked. What was it, 17% in one day?
Yeah. And they pulled their earnings guidance for the whole year. I mean, that sounds like panic stations. Financial DEFCON 1, like one source said.
It absolutely signals a massive problem. And the core of it, according to the sources, was Medicare Advantage just hemorrhaging money.
How so? What happened there?
Well, medical costs just shot up unexpectedly, way higher than they planned for. So their profit margins in that really crucial segment just imploded.
Wow. So when the CEO leaves right then, amidst that kind of financial meltdown,
It suggests really deep problems, right? Maybe their whole model or their projections for that profitable area were just way off base. Fundamentally flawed, perhaps?
and then who do they bring in? The old CEO, Stephen Hemsley. He was board chair, now he's CEO again.
Super unusual move. The sources compared it to the captain bailing mid-hurricane and then the old captain having to come back.
And he got a nice payday for it too, right? Like $60 million?
Mm-hmm. $60 million package.
What does that kind of move, bringing back the old guard with that kind of money, tell you?
Well, it could mean a few things. Maybe they just wanted a familiar hand on the tiller in a crisis.
Mm.
But it also might suggest, a lack of good succession planning.
Or maybe resistance to new ideas?
Could be, and that big paycheck. It might signal they're playing it safe, going for stability rather than maybe the radical change something is needed.
Okay, so that's the insurance side. But there's also big news at Optum Health, which the sources call their not-so-secret weapon. Patrick Conway took over there in June.
Yeah, that's a really important piece. Optum is huge for United Health clinics, pharmacy benefits, data stuff. It's their big growth engine.
And Conway, he's got a background focused on value-based care.
Right. He's a physician, former government guy from CMS, known for focusing on patient value, not just volume. His job, based on the sources, is to sort out Optum's own issues from Q1 higher costs, problems integrating things.
So bringing him in looks like a move to strengthen that core part of the business, maybe align it better with, well, actual healthcare value.
Seems like it. Fortify the growth engine and maybe address some of the cost issues they saw earlier in the year.
Okay, shifting gears now to something much darker. The sources mention the unsettling death of Brian Thompson. He was the CEO of the insurance arm, United Healthcare.
Yeah, that was back in December 2024. Found dead in New York City. Suspicious circumstances the police are still investigating?
What are the sources saying about that? It sounds incredibly strange.
Well, there are lots of theories floating around, according to the materials. Robbery, maybe something targeted, even corporate sabotage was mentioned.
And the company's reaction?
Radio silence is how one source described it, which understandably just fueled more questions and speculation, not great communication in a crisis.
And here's a really disturbing detail from the sources. Thompson was apparently pushing for reforms in how they handled Medicare Advantage billing.
Right, an area that's now under this intense federal microscope.
So him pushing for reform in that specific area and then his death under these circumstances, it raises some really uncomfortable questions, doesn't it, about the pressures involved?
Absolutely. Regardless of what actually happened, the timing and the whole situation just added this layer of deep unease on top of everything else. It definitely amplified the investor concerns and cast a shadow over the company during an already chaotic time.
Makes you think about the stakes involved in that whole Medicare Advantage world.
For sure. The pressures seem immense.
Let's get back to the financials for a second, because the sources paint a picture of just carnage. Q1 2025 was described as a disaster.
Yeah, the numbers were bad.
What drove that?
Primarily, it was people using healthcare services more than expected, especially, again, in that Medicare Advantage population. Higher than expected utilization rates is the term.
So basically, older folks needed more care than UnitedHealth budgeted for.
Pretty much. It kind of hints that maybe their push for profits in Medicare Advantage was based on perhaps unrealistic assumptions about people's health needs.
WizSource had that quote, didn't they? Something like, older Americans don't magically become healthier just because UnitedHealth wanted better margins.
Exactly. That surge in actual medical costs just blew up their financial plans, exposed a real weak spot.
And the market reaction. Oof.
Brutal is the word. They pulled their guidance for the year and bam, $100 billion wiped off their market value. Just like that.
Analysts went from buy to, what was it? Maybe if you're into extreme sports.
Something like that, yeah. One source called it a fiscal faceplant. For a company that usually prides itself on predictability, this was a huge shock.
That loss of predictability, that loss of trust, that's probably harder to fix than just the money, right?
I'd say so. Rebuilding that confidence takes time and consistent results.
Okay, so domestic problems are huge, but they were also looking abroad, weren't they? Latin America? That didn't go so well either, according to the sources.
No, not at all. Big strategic retreats happening there.
Yeah.
They had this massive $8.3 billion write-down linked to that expansion.
$8.3 billion, wow.
Yeah, and now they're trying to sell off Banmédica, their insurer down in Colombia and Chile, for about $1 billion. So taking a huge loss on that whole venture.
Is it just Latin America, or are they pulling back elsewhere, too?
Seems broader. The sources say they're bailing on international ambitions generally. Exits from Brazil, Peru, too. Looks like they're really refocusing everything back onto the U.S. market.
So, circling the wagons, basically. Doubling down on the U.S., especially government programs like Medicare and Medicaid.
That seems to be the strategy.
Does that make them leaner, or just put all their eggs in one very complicated, very regulated basket?
That's the million-dollar question, isn't it? It simplifies their global footprint, sure, but it also means they're even more exposed to the pressures and the scrutiny in the U.S. market, particularly those government segments that are causing them trouble.
Speaking of scrutiny, focusing back on the U.S. doesn't get them out of the regulatory spotlight. Actually, the sources say they're walking into an audit apocalypse.
Oh, yeah, vivid term. CMS Medicare and Medicaid Services is seriously pulling back the curtain on Medicare Advantage.
How?
They've brought in like over 2,000 new auditors, and they're specifically looking at what the materials call egregious billing practices.
Like what, for example?
Well, one source mentioned those charming in-home wellness visits that always seem to find 14 new chronic illnesses per senior citizen.
Okay, right. So the implication is potential upcoding, finding more conditions to justify higher payments.
That seems to be the concern CMS is aggressively targeting. It's not just about typos, it's about systemic issues, potentially inflating costs.
And UnitedHealth is right in the middle of this.
Squarely in the hot seat, as the sources say. And it's not just CMS. The Department of Justice is apparently sniffing around for potential fraud, too.
Ooh, DOJ involvement. That takes it up a notch. Fraud is a whole different level of trouble.
Absolutely. Much more serious than just regulatory fines.
So UnitedHealth has made some public promises, right? About reforming things like prior authorization, playing nicer with regulators.
They have. They've made commitments. But, the sources are pretty skeptical. One asks if actions will speak louder than press releases.
Fair point. With this much heat from CMS and the DOJ, it suggests the problems might run deeper than PR can fix.
Exactly. It looks like a fundamental challenge to how they've operated.
Okay, but it's not all bad news, is it? There was a bright spot mentioned. The ACA exchanges.
Yeah, the Affordable Care Act marketplaces. UnitedHealthcare has actually been expanding there quite a bit, reaching millions more people in, 30 states now? Over 1,200 counties.
So what does that move signify?
It feels like a return to the bread and butter insurance business, as one source put it. It's maybe not as flashy or potentially as profitable as Medicare Advantage was supposed to be, but it's growth in a more straightforward market.
A way to rebuild some credibility, maybe diversify a bit away from the Medicare Advantage hot seat?
Could be. It's a solid step, shows they can still execute and grow in other areas.
Now, with all these shifts, the financials, the leadership, it inevitably leads to talk about the company culture, doesn't it?
Yeah, the sources bring that up. Critics argue UnitedHealth had this deny, delay, defend approach,
Mm.
more focused on the shareholders than the patients, essentially.
And the company's response, promises of change.
Yep. The board's talking about a new era of accountability. Hemsley, the returning CEO, ordered a big risk review. They're even talking about tying executive pay to things like regulatory compliance and patient satisfaction.
But there's skepticism.
Oh, yeah. The sources are pretty blunt. Culture doesn't change with memos. Real change, they suggest, needs more than just talk. It needs actual consequences for the old ways.
Like that quote about firing someone for bad behavior instead of giving them a bonus.
Exactly. That's the kind of action that signals real cultural shift, not just rearranging the deck chairs.
So looking ahead, what's the path forward for this giant? They're still huge, but they've got this massive trust deficit, as one source called it.
It's a tough road.
Yeah.
They need to stabilize earnings, obviously, get out of Latin America without too much more damage, get Medicare Advantage under control before CMS brings the hammer down even harder.
Keep Optum running smoothly under the new leadership.
Right, and somehow rebuild public and regulatory trust. And that has to be through actions, not just words. Prioritizing people, genuinely.
And this whole saga, it's more than just about one company's problems, isn't it? The sources connect it to bigger issues in U.S. healthcare.
Definitely. It highlights things like the system's heavy reliance on Medicare Advantage for profits, maybe an over-reliance.
And the whole ethical tightrope walk of optimizing billing. That phrase stood out.
You did. And, just the fact that there's even speculation linking a CEO's death to policy fights.
Mm.
That says something about the intensity and the stakes in this industry.
It really drives home that when the biggest player stumbles this badly, everyone feels it, from Wall Street traders to patients in clinics.
Absolutely. The ripples spread far and wide.
So we've covered a lot: the leadership roller coaster, the financial hits, the strategic U-turns, the regulatory crackdown, that small ray of hope with the ACA, and this big question mark over their culture. It's a lot for one company to handle.
It truly is. It shows the immense pressures and vulnerabilities, even for a company of UnitedHealth's size and influence. They are absolutely at a crossroads.
And the decisions they make right now, well, they're going to reverberate through the whole healthcare landscape, won't they?
No question about it. What happens here matters far beyond their headquarters.
So I guess the big question hanging in the air is, can UnitedHealth actually learn from this? Can they adapt, change course, and maybe even lead again?
Or is 2025 going to be remembered as the year this healthcare Goliath just tripped over its own feet, maybe its own ego, as one source suggested?
It's definitely a story to keep watching because it tells us so much about the tricky, complex, and sometimes fragile nature of the American healthcare system itself.
For sure. This story, it feels like it's a long way from being over.